Hi, my name is Ishmael Ariano, and I'm a soon to be senior here at Cal State University Fullerton. I'm here to present to you the definition, the causes, the treatments, and a way to prevent the STD or STI known as gonorrhea, aka the clap. Before I get into all that, I created a pre presentation quiz. It's pretty straightforward. There's 10 questions. All the questions are pretty simple, such as what safe sex means to you, naming a couple ways that gonorrhea is spread, or naming 3 places in the body that gonorrhea can really infect. All of these answers will be in my presentation, so you can keep these questions in the back of your mind as you really just listen to me talk and hear the ways that I can answer all of these questions for you individually. Defining gonorrhea. According to the CDC, it is a sexually transmitted disease caused by infection with the Neisseria gonorrhoeae bacterium. As I said, it's also referred to as an STI, which is a sexually transmitted infection, because it infects the mucous membranes of the reproductive tract of both women and men. In a woman, infecting the reproductive tract includes the cervix, uterus, and fallopian tubes, as well as the urethra in both women and men. It can also infect the mouth, throat, eyes, and the rectum, as well as the vaginal cavity. It is a common misconception for many people in the United States as well as around the world that only women can contract this virus or this disease or infection. And it is important for men to be educated on the fact that they can also get this infection as well as the symptoms that come with it. In the United States, according to most studies, it is the second most common bacterial STD infection that we have here. As I said, it can infect both women and men, so it is very important to be cautious of that. Like I said, it can also be called the clap, or even, as some people call it, drip. As for the cause, it's pretty straightforward as well. As being a sexually transmitted disease or a sexually transmitted infection, the main way for it to be spread throughout it really is through oral sex, through anal sex, or through vaginal intercourse. Some other ways that people spread this and not really think about it is having multiple sex partners, which we definitely do not recommend because obviously you don't know where everyone has been at certain times. And also a blatant disregard for the practice of safe sex, which in simple terms is just using a condom. Also, coming in contact with someone that is infected with this might be some of the worst case possible for someone who really hasn't experienced this type of infection or disease that has been going around for as long as I can remember. It's not only a sexually transmitted disease, but it can be handed down from a mother to a newborn child during childbirth. And we can really see that in the child because it commonly affects the eyes more than anything. And it can really cause major problems in the pregnancy for the mother and the child as well. As for effects on sports and performance, as you can see in my presentation, I've written down that it can cause, if untreated, complete debilitation and major effects on sports performance and any type of exercise in general that you decide to do with this infection. Also, if not treated, rarely, but still possible, it can cause infection, pain, and inflammation in the joints, which is really arthritis, infection in the heart, infection in the brain, meningitis, or in very rare cases, but also still possible, it can cause death. So it is really important to stay away and really practice those safe sex ideas as well as abstinence. As you can see to the right in that little picture, we can see that gonorrhea also causes painful urination, abnormal discharge, and vaginal bleeding, which can really affect a woman and her ability to perform in a sport or really just any exercise in general. As for treatments, we're actually really lucky that this is one infection or disease that can be cured. There are only a couple ways to cure this, which is really a 500 milligram intramuscular dose of ceftriaxone, according to the CDC, as well as medication that can stop the infection but will not repair the damage that the infection had done. We can see to the right some of these pictures, as well as the CDC saying that they no longer recommend a 2-drug approach rather than this 1-drug approach in the intramuscular dose. And also in the bottom picture, as well as what I've written down to the left, we can see an increasing rise in antimicrobial resistance, which is a definite concern for these doctors because it makes gonorrhea more difficult to treat. It makes follow-up tests more important, and it just shows the signs of emerging antibiotic resistance, how diseases and infections like this can evolve to really just outlast our medicine. These follow-ups should be within 7 to 14 days after the treatment, but are only really needed for throat infections and not rectal or genital. As for prevention, we can see in the top right that practicing safe sex, as in simply putting on a condom, like we see on this banana, is probably one of the better ways to keep a clean record, as we can say. If having a monogamous long-term relationship isn't an option for you at the moment, safe sex is definitely the way to go. Another way to go that is definitely probably the most, I wouldn't say looked down upon, but the least used, is abstinence from sexual intercourse of any kind, which includes oral, vaginal, or anal. This is probably the best way to prevent this disease or infection from spreading, but like I said, is probably the least used way. Also, testing both parties before intercourse is a really good idea. Another lesser used way to stop the spread, but definitely useful. We can also see in the bottom right picture that sex ed has taught us a lot, and we should definitely use all of these 4 rules to a T. As we can see in rule number 1, do not have sex. Rule number 2, see number 1. Rule number 3, see number 2. And rule number 4, see number 3. Lastly, I just wanted to show some of these pictures that I thought were interesting. Up in the left, we see the different microorganisms that are known as STDs or STIs that we really suffer from. It's cool to see the differences as well as the similarities in some of these microorganisms and how we can distinguish each of these STIs from one another. Something else that was interesting to me was here in the top right, we can see Ohio's STD cases, and we can see chlamydia and gonorrhea are way above the rest in how prevalent they are in Ohio. Ranking number 14th for Ohio seems like it would really be high, but for the populace, being that Ohio is the 7th most populated state and cities within the United States, ranking number 14 is actually pretty low for them and actually pretty scary for the other states in the United States. In the bottom, I just wanted to show some statistics on how COVID even affected the spread of gonorrhea, syphilis, and even chlamydia. When we were in lockdown, gonorrhea and syphilis, as well as chlamydia, really just dropped a whole lot. And then right when we get out of that restriction, we can see them jump right back up to where they were, and even surpassing the numbers where they were in previous years.